Hey, I'm Dr. Bryan Pankow. I'm a chiropractor and the owner here at Nobility Chiropractic Wellness in Smith Falls, and I am here today to talk a little bit about what we do. If someone who had no idea who I was or what I do were to ask me what I do, they'd never seen a chiropractor before, no concept of anything, I think the best way I can describe what I do is basically I work to optimize people's movement. Depending what that looks like for people, it can be symptomatically they're coming in for pain or they're coming in for, again, performance enhancement, injury rehab, whatever that looks like. But the basis of what I do realistically is I'm going to look to see where the dysfunctions are in their movement. More often than not, that's what's causing their pain or that's what's led to their injury or is putting continued stress and slowing down the injury rehab. Sometimes there are some specifics I would do with, again, different injuries, things like that. But overall, in very few words, what I do is help optimize movement. I got really excited to be able to get into a career where I got to work with athletes because my background growing up was very athletic myself. Growing up, I had a huge interest in just athletic training in terms of being able to play soccer and football at the highest levels I could. And so I spent a lot of time and honestly dedicated pretty much my career in undergrad doing a degree in kinesiology to learning how to become a better athlete myself and how to make other athletes better. When I got into the chiropractic fields, my first experience with chiropractic was actually, again, as an athlete. I used to get a lot of SI joint pain when I was running, and I just consider that very normal. The first time I saw a chiropractor, that completely went away, and I was just shocked when I could run without being in pain. And unsurprisingly, without the pain and without the dysfunction, I could also run faster and further. And it's been really cool being able to take that kind of approach and working with athletes and just help people become kind of the highest performing version of themselves. So in terms of working with athletes, realistically at all levels of performance, between the weekend warriors and the elite professional athletes or Olympians, my goal is just to help people remove the barriers that they have to performing at their peak. So whether that's beer league hockey or whether that is genuinely competing at the world stage, everybody has something that holds them back. Whether it's pain, whether it's movement dysfunction. And so being able to work with that and help take that away and help people just kind of like experience what they can perform to is so much fun. In a lot of ways, I am different from other practitioners, especially in the area. I dedicated a lot of time to learning a technique system called applied kinesiology. Most people are just going to know it as muscle testing. And I find working with athletes, at least in my experience, the muscle testing can be incredibly helpful because it allows us to really isolate different dysfunctions and then get to the cause of why that dysfunction's there quickly and see changes very, very quickly. It's always fun watching people walk out of the office for the first time or the 10th time or whatever, noticing that big change right away. It doesn't always happen, but with patients, I do tend to see results pretty quickly in the office, which is really cool for both of us. Well, working with my patients and especially working with my athletes, I use a wide range of techniques. The one I rely on mainly as a diagnostic system is going to be something called applied kinesiology, which most people are familiar with as muscle testing. I really like using that, again, especially with athletes, because I find it very, very helpful in isolating and discovering different movement dysfunctions. Once we've discovered it, in terms of correcting those movement dysfunctions, we really try and isolate the very specific cause of the dysfunction in the first place, and then correcting it can bring in a variety of different techniques coming from, quite honestly, not just chiropractic, but a lot of other backgrounds as well. Sometimes more massage or soft tissue-based interventions, sometimes drawing from osteopathy, sometimes nutritional. And as we can work through those, whatever that specific situation calls for, and it can be very, very broad, we can often see pretty quick changes in those dysfunctions so that people notice a difference leaving the office. So understanding that everybody is different, I think, is a big, important part of providing care. And quite honestly, every time somebody steps into the office, everything I do is based on an assessment on that day. So understanding that what somebody needs might be different from what somebody else needs is a big part, but also understanding that what somebody needed a week or two ago might not be what they need today. So there's a heavy assessment component to the way I work with patients, so that everything is really, really tailored to the person in front of me. And we're able to really hit on what they need specifically that day for that patient at that time. I love working with athletes, partially because of my own athletic background. I dedicated a lot of my life to sport in different ways, and I still am fairly active and still compete in rugby and have a lot of movement-based hobbies. In terms of working with other athletes, I always got excited myself seeing performance improvements, and I will say it's the same thing with other athletes. And whether it's we're dealing with an injury and we get them back to the field and they're excited to get back to sport, I love seeing that. I also love getting an update the next time I see the athlete, or sometimes even the text afterwards saying like I hit a new PR or I broke a record. Being able to help push people's performance that way, whether again it's coming back from an injury or just taking them from an already good point and pushing it even further in the right direction, is really where my passion lies. And it's always really, really exciting when I get to do that. One of the biggest challenges I think I face in terms of continuing practice is, now that I'm out of school, trying to keep up with advancements in both care as well as different technologies that exist in the healthcare field, in the sports sciences field, and in the rehab fields, and actually bringing them to people in practice. I end up doing a lot of continuing education, so whether it's taking a course or whether it's going to different seminars or conferences, there's just so much out there, quite honestly, that trying to find both the time to keep up with everything as well as the right things to keep up with is probably one of the biggest challenges I face. I like to think I do a good job bringing a lot of new stuff back, and I'm able to continuously raise the bar in terms of the care I'm providing. And so that's how I try and tackle that. But yeah, just the vast breadth of information that's continuously developing is one of the biggest challenges, I think. One of the big things we're working on right now at Nobility Chiropractic in Smiths Falls is working on expanding our offerings and trying to really make ourselves more accessible to athletes and people who need care throughout the Ottawa Valley. This has traditionally been a Thursdays only practice for me. I'm usually obviously practicing out of Ottawa. And so trying to bring in other services, recently having brought in Dr. Morgan Quick, a chiropractor who's able to both offer more availability in terms of chiropractic care as well as expand into offering acupuncture, has been really big for us. We've brought on Megan LeBlanc, a massage therapist, and so being able to offer, again, some massage therapy availability and just be able to offer more to the population that we want to serve here in Smiths Falls and the Ottawa Valley has been a big one, and we're hoping to continue to be able to do that.